Welcome back to Daytime, everybody. Dr. Trina is here. She's here with the Advanced Chiropractic and Wellness Center. Sometimes my tongue doesn't move. Welcome to the show, Trina.
Thank you. Thank you for having me.
What we're looking at today is really the advancement in chiropractic care. So what is the machine that we have in front of us?
Well, this machine is really the latest technology in chiropractic, although the technology has been around for about 15 years. So what it does is it allows me to find exactly where the spinal fixations are with a computer. Okay. So what I would do is I would basically have the patient just like this, and if we're going to assess her mid-back perhaps, let's say.
Okay.
We would take this instrument, which is attached to the computer. So it's a very gentle tuning fork-like instrument, which uses a piezoelectric sensor. And what I do is I essentially use a gentle clicking down the spine.
So that's looking for the curvation of the spine? Would that be correct?
Right. Well, it's more looking for the fixations in the spine. Okay. Because if you have stiffness in your spine, that can be the source of neck pain, back pain, headaches, a whole other host of symptoms. So once we've objectively identified the areas of fixation or stiffness, we can then treat the problem.
Now, looking at the computer screen, when you did that little clicking, now it has this chart.
That's right.
Or a graph.
Yes.
What is that telling you? What can you see from what you just did?
Well, each of those little waves represents the fixation in each of the vertebrae. So if there is fixation, the shape of the waves will tell me whether or not the vertebra is stuck. And therefore, if the vertebra is stuck, it might be causing your back pain. So that way, once we've identified the areas, and that's all based on the shape of the waves there, without getting to the physics behind it, but what we do then is now we use the same instrument to do the treatment, as well as finding out where the problem is. So after we set up the settings, it's all right there in the computer. I get right onto the vertebra that needs to be adjusted, take the same instrument, and it's a very gentle tapping sensation.
Wow.
Scared me a little.
Yeah. I know. It's a little bit of a scary sound, but I can even show you on your hand here what it feels like.
Yeah,
just
no,
so
that
you
would
know.
be great.
Here, if you want to turn your palm over, that's all it is there.
Okay, so are you sending sort of pulsations into the spine to readjust it, or how is it working?
It's no x-rays, no ultrasound waves, or anything like that. The adjustment itself is the tapping sensation. Because what it does is instead of the twisting or turning or cracking, it essentially taps in the vertebra into place until it moves better.
Which over time, when you keep up with this treatment, it really makes a huge difference.
Yeah, absolutely.
But it's less hard on the body.
Yeah, well, there are just some patients who can't tolerate twisting or turning.
Okay. Right.
That's all it is, especially some children are worried about their children, or, people in wheelchairs, if we can treat them, because, again, they get back problems just like everyone else, and so it's very easy to get them up in the chair. And so that way it's minimally invasive.
So would that be the only method you would use then?
I do, yes. Yes,
okay.
We only use this method.
Can you show us again on a different
absolutely.
part? I mean,
we're going to go a little bit lower down this time.
Okay.
And then the best part after the treatment is done, we get to rescan the area. So that way we get to see before and after.
Oh, so you can actually see the second lines are where they're sitting now.
That's right.
So
you can see before and after how you're actually doing.
That shows you a difference, right?
That's right. And it does actually look a lot better. So again, without getting to the details of it, but we do get to see, the great thing is that both the patient and the doctor get to see.
I'm looking at it and I can see the two spine columns. The first one has much stronger, almost like a V almost, but the second one is a lot smoother and rounder. Is that what you're looking for?
You got it. Exactly.
That's what you
it's
want.
just that simple. Yeah.
No misalignments.
Exactly.
Okay, so who would benefit from this type of chiropractic care?
Well, like we said, everybody has a spine. So everybody has back, neck pain. So we treat a lot of that, chronic conditions, things like headaches, but especially people who just don't like the twisting or turning. It's not to say one is better than the other, but some people just can't tolerate it or they don't like it. So that's, the number one reason people don't go to chiropractors sometimes. So that's really the people who benefit from it.
Now, do you teach your patients about what they see on the screen? Because part of it is also educating them about what's going on in their body.
Absolutely. And in our clinic, we are very big on education, because the more you know, the more you can better take care of yourself and your body, make the right educated health care decisions. So how we do that is, let's say you have a problem at your mid-back here. So what we want to do is we pull it up onto the screen. So all the educational material is right here on the screen as well. So if I've got a problem in the low back, I can blow up this area here, show the patient where their nervous system problems may be coming from, or where their joint problems may be coming from. And so that way they can see why they're getting pain, not only just in the area where it hurts, but maybe somewhere else.
I love that you can actually see where it's happening.
And I think this helps a lot, because I think that even today there's still some mystique about chiropractic, and it's just bending and cracking. So this really gives the client the real idea of what's going on.
That's right, and it's clear and it's concise and easy to understand for everybody. So that's the best part, both the patient and the doctor can see what's going on.
Can you actually take a step to your left? There, we can see your face now. So at your clinic in Stouffville, if people are you know they have pain, maybe they're not feeling the best that they could be feeling.
Yes.
Why would you suggest chiropractic for, you know, ailments like headaches?
For ailments. Well, often,
You know?
because, you know, honestly, people come to chiropractors as last resorts. They've been to the medical doctors, they've been to
Right.
the neurologist, they've been told their CT scans or MRIs or x-rays show nothing. And in that case, it probably is a chiropractic problem because their spine isn't as moving as well as it should be. There's stiffness there, there's pressure
Yeah.
on the nerves. So in that case, chiropractic care can get to the bottom of the problem instead of giving a Band-Aid solution. Because you can cover it up with drugs. You can get the Band-Aid from somebody else.
Right.
But eventually that Band-Aid is going to fall off.
Okay.
And so that's really how chiropractic care differs in general. We want to get to the source of the problem, correct it, and get rid of your problem that
What about
way.
the self-medding chiropractor who cracks the neck and adjusts the back every day? Is that causing a benefit or is that hurting a little?
You know, I do believe chiropractic, whether you do it manually, whether you do it with another type of instrument, whether you do it this way, it all works. But we just prefer using this method because I used to do manual adjusting and now I do the Pro Adjuster. I've had over 2.5 years of clinical experience. I've probably treated hundreds of patients, delivered thousands of adjustments. And I just know for me personally and the results I get, they're great.
Can you ever just look at a patient like the one we have now,
Yes.
and by just touch, can you feel if there's a misalignment or anything that's not right?
Yeah, absolutely. We still use palpation. We still use what we call the older ways of doing it because those are tried and true ways as well.
Right.
This just delivers the next level of getting to the bottom of the problem for us anyways. So I still do my orthopedic testing. I will still send patients for x-rays. But yes, so we do use the instrument and we use our hands still.
Oh, I love it. And I love that people can actually see what's going on in their own body
yeah.
and why, you know, she's working on a certain part. It's really all about education at the end of the day. If you'd like to stop by the clinic, it's located in Stouffville, Ontario, 905-591-2591, or go to the website advancedchiro.ca. We'll be right back with more on the show. Welcome back to Daytime York Region. We're really excited to have Adi Lando here from Sephora, from the Upper Canada Mall in Newmarket. He's a Sephora Pro Beauty Team expert, and we're getting ready for the holidays. Everybody has those parties
Yes, you gotta
and
look good.
different functions that we want to go to and have a trendy and, you know, holiday-inspired look.
Absolutely.
Adi, welcome to the show.
Great to be here.
So when we think of holiday, it's sort of a glamorous time, isn't it?
Absolutely. You know, the holiday is just around the corner, and everybody is going to go to one party or two. So
sure.
let me show you like a really, really simple thing to do, you know, so you can carry from a day look
Right.
to a night look in few seconds.
Okay.
So we already prepped her lips, and
Okay.
I think red lipstick, you have to have that, in your makeup bag, because red really gives it this sort of glamorous holiday feel to it.
Yeah.
So it's already look really, really great on her. If you didn't have time to even fuss with your eyes, if you have the red lipstick, you're ready to go.
It's a
That's it.
sexy
That's all
look
you
too,
need.
isn't it?
Absolutely, absolutely.
Yeah.
And it looks how it brights up her skin.
Yeah, it does.
So really quick for the eyes,
Okay.
The recipe. So basically what you're going to need is 3 different ingredients. One is a cream eyeshadow. So basically what I'm going to do is...
cream eyeshadow. Why is
cream
that good?
eyeshadow. And I'll show you why. Close your eyes. And you want to dab the cream right on top of the eye.
Okay.
Because when you're going to put sparkles on, it's actually going to
almost like a
catch.
paste-in.
Oh,
Exactly.
it'll hold the sparkles
That's
in
right.
I
place.
like that I know the makeup talk already. This is fantastic.
Oh, look at this.
And a little bit of sparkle, and I chose the sparkles by Makeup Forever.
Okay.
And they come in different colors, and they're really, really nice and very festive for the holiday.
That's gorgeous.
Open your
And I
eyes.
guess what the message is as well is everyone's so busy. I mean, you got to
Absolutely.
come home and then go to the party. This is so easy to do.
Exactly.
Yeah.
You can buy those ingredients and do it even after work, in your office even.
Yeah.
And it just gives, it's not like her whole eye is sparkling. It's almost like when she blinks, you see this little flash of something.
Absolutely. And another thing, that probably you want to keep in mind
Yeah.
is false lashes. You always have to have those for a great party on a town.
Right.
So again, great lashes go really, really well with this kind of a look.
Okay.
And it looks really festive.
Can I
and
see those?
Those are really
Yeah,
sparkly
Holy
false
absolutely.
lashes.
smokes.
And those ones actually has like gold to it.
So is that like a
Tip-top.
glam false lash?
Yeah, absolutely, and they come in different shapes,
these.
for different occasion. This would be more for a holiday party.
Right.
Okay. Now, will people notice you wearing the fake eyelashes?
betcha.
You want them to with a look like this.
Absolutely, but what you're going to have to do is you're going to have to cut them and measure it to your eye shape.
Okay.
That's before you're actually putting the glue. And what I would recommend is one tip is you want to curl your lashes before and put 1 coat of mascara, and then the eyelashes would sit better on the eye.
Okay. Wow. So
Yeah,
now,
look how pretty she looks.
with Deanna's look, is she good to go, or is there any sort of last minute touching up that we
So
need to
basically
do?
what I would do is more mascara, a little bit of glitter, red lipstick, a little bit of a blush, and you're ready to go.
That's it.
Absolutely.
Can we do the other eye just so she's
Yes,
balanced out
for
the
sure.
so she doesn't have one sparkle and one,
And it's really easy. And look, I even do it with my fingers, so
Well, you
don't
could
even
almost-
have to have brushes on hand.
You could almost just put this stuff in your purse. A lot of us go to the party right after work. Excuse me. So you could do this here at work, or
in the car driving, as I see everyone doing.
maybe not do that.
And you know
Don't
what?
do
It's okay if there is a little bit of fallout on the skin. It looks like a
pretty.
nice snow falling.
Now,
So-
when
go
it
ahead.
comes to the red lip that Jeff loves so much, I wanted to ask if it should be nude and not shiny, or can we add some gloss to sort of pump it up a bit?
That's a great question. I think, that if you put a lot of glitter on your eye, maybe you want to go with more of a matte tone
Right.
lipstick. So in this case, this lipstick is matte. Or if you decide not to wear the glitter because you're that person that doesn't like glitter, I would definitely go on more of a shiny lip.
Okay.
Yeah.
Which can we see it?
Which I'm going to do right
This
now.
is great because the shiny look is also in. If you just
Oh,
did,
the shiny look says
a
kiss
simple
me.
eye.
It says come over here. And I like the
Yes.
shiny
oh, I
look.
love this. Who
See,
makes
that
this
looks really good.
color?
So this one is by Sephora Collection.
There you go.
Pretty.
There you
Very nice. She's ready to go. Now, when it comes to holiday, items, Sephora is so great because you really put together some great packages for people
Absolutely.
as gift ideas.
This is the best time, to go and visit in our store
Yeah.
because we have so many different beautiful things. Look at this, for example. It's called the Blockbuster Kit. And every year Sephora making